Federal regulators are cutting off funding to San Francisco's Laguna Honda Hospital, a move which threatens to shut that hospital down.
Medicare has already mandated some transfers of patients out of the facility. 9 people who've been transferred have subsequently died.
9 patients have died after being transferred. This is a matter of life or death.
By no means can we close an important facility that serves the most vulnerable in our community. To do that is death.
Laguna Honda Hospital is the largest publicly funded skilled nursing home in the nation. It has around 700 skilled nursing beds. It's been in the city since the 1860s, serving patients. And it has 2 populations. It serves medically delicate, at-need seniors, and it also serves folks with behavioral issues and substance abuse issues here in the city. So let's talk about what led to this closure. In 2021, Laguna Honda reported 2 non-fatal overdoses with their patients. Patients had brought in from the streets drugs like fentanyl and meth. Laguna Honda reported this to the California Department of Public Health, and that launched a survey of Laguna Honda more broadly.
But when there were reports of infractions between staff and patients, contraband, Laguna Honda violated the federal and state safety rules.
So all of those issues added up, and the Centers for Medicare and Medicaid Services decided to pull funding and mandate a closure for Laguna Honda on September 13th, 2022.
And then you're supposed to move out 700 patients in 4 to 6 months when there's no place for them to go. It just seems cruel.
So obviously there were issues at Laguna Honda, to be sure. But when this mandate was set in place, Laguna Honda began transferring patients. They transferred over 50 of them. And what we saw is that 9 died in the days following those transfers.
They don't want unsafe discharges, but this is what happened at Laguna Honda. At least 9 people died. And 1 died in medical respite, which is a form of homeless shelter. They died immediately, terrified and alone, without a familiar face.
You don't know what is gonna be with your life. And you are worried all the time, sometimes day and night. We don't know what is gonna happen with us.
It's been very, very stressful, very stressful. I mean, visions of seeing your brother laying on the street like you see homeless people because he can't walk. He's my older brother, Anthony Diufemia. He's been living at Laguna Honda since 2021. He's 76. He ended up with spinal stenosis, and when he started to not be able to walk and fall, and they were afraid he was going to kill himself by falling, so that's why he needs skilled nursing. He's very smart, he's funny, he really loves living. He just wants to live forever.
I am the husband of Carrie Campbell, and Carrie Campbell's mother, Elizabeth Campbell, is a resident at Laguna Honda. We call her Betty. So Betty's 86 years old. She suffers what's called vascular dementia. It got exceptionally worse about 5 years ago, and it's that when we realized that we needed, basically 24-hour care for her. Betty talked to everybody. She'd make best friends, within a few minutes. She always showed interest and wanted to learn more.
So as far as the patients that eventually may need to be transferred out, one of the major issues is that there simply aren't skilled nursing beds available for them outside of Laguna Honda here in San Francisco.
That facility that we were going to move her to, we learned soon thereafter that 2 people died as a part of the transition. Meanwhile, Betty was about ready to go into it. Then we stopped her.
So Laguna Honda has offered skilled nursing places in Burlingame and in Modesto. Modesto is 2.5 hours away, and this facility closes at 5 p.m. I just said I'll never get to visit my brother under those circumstances. Have to take a vacation to go visit him. And I'm his only family, essentially. I'm the only one in contact with him.
I don't want to finish in a facility far away from my family. It's hard for them to travel to visit. It's very important. You are so happy when they come to visit you or when you meet with them, right? Right here is our house.
So after these 9 deaths, we really saw an outrage spark in the city. We saw community members, family members all say that this maybe isn't the best path forward. The Centers for Medicare and Medicaid Services initially decided to pause the patient transfers and extend the closure date of Laguna Honda by 2 months. They since agreed to extend funding for the hospital to November 13th, 2023, as long as all health and safety standards are met. However, patient transfers and discharges could potentially resume on February 2nd, 2023, and that date is fast approaching.
It's been nice to have a little bit of a rest, but it's not over.
Yeah, we've never tried to evacuate 700 people into the community in a matter of months. I think this pause is going to restart and is going to be a fit and start back and forth, and it's going to kill some people.
People will suffer cruelly from poor care and from being unable to access their families and their community. San Francisco is better than that. We need to do better.
I saw many people who live right here and they move outside. They don't live for a long time. That's why it's very important to keep Laguna Honda open, you know. All of the patients right here, we are praying, but unfortunately as a patient, we cannot do it too much.
And so I think the big question on everyone's mind right now is, should Laguna Honda close? Is that a right approach for all the patients that are there and for patients that potentially their lives could be put at risk because of this closure? And on a national level, if Laguna Honda does close, it bears the question, what does this mean for elder care across the country? And that's a question that a lot of families are asking.
My greatest fear with getting older is that there is no humane treatment. There's no dignity and respect.
Laguna Honda is a canary in the coal mine for the whole health system in San Francisco as we're growing older. And if the people of San Francisco don't work hard to keep their nursing home, the powers that be may take it from them.